So welcome to the bottom up series of the hip. This is the fourth lecture we've done on the hip. We started at the foot and then went to the ankle and then the knee. And now we're at the hip, or excuse me, the fourth lecture of the bottom up series. So we've kind of been working from the bottom up, hence the title. This was an original series that we did in person at BP Run Co., which is a local trail running store here in Denver. So I just want to give a shout out to them that it's a lot of fun in person, but we just moved it virtual so that people who can't get to their running store have a little bit more access to it as well. Wanted to give them a shout out. My name is Gabe Dorn. I'm a PT and coach and part owner of BP Run Co. Or excuse me, not BP Run Co. Part owner of Golden Endurance. And a little bit about Golden Endurance. Golden Endurance was created by Sammy, myself, as well as Mark. Sammy and I are PTs. Our motto is we're physical therapists who coach. We're coaches who do PT. Mark is not a PT, but he's a great coach and has a lot of experience in the 100-mile realm, kind of the ultra realm. So we're lucky to have him as a friend and on board with our business. We're based out of Golden, Colorado. We offer strength programming, physical therapy, and run coaching services, both. So the run coaching and strength programming are virtual, and the physical therapy is in person. We've also, if you've been in our clinic, you know we've got a clinic dog named Penny. She's a burner. She's a sweetheart. She hangs out in the clinic. We just recently got another burner named Riley, who is 2 years old and is a wrecking ball and does not yet hang out in the clinic, but we're working on it. So that's a little bit about us at Golden Endurance. So today, the hip, we're going to kind of go through anatomy and kinesiology, kind of the fundamentals of the hip, as well as hip function for runners, common conditions of the hip, mobility exercises, and strength exercises. And so it'll hopefully get more practical towards the end. We're going to start with kind of the basics and then go on from there. And feel free to interrupt if you have any questions, and we can address them as they come up. But that's kind of where we're at. So anatomy of the hip from the front. So you basically got the spine, and then you've got the pelvis. This is the ilium, and then the pelvis comes down, and this is more the groin area. And then you got the hip bone itself, and this is the femur, and it's a ball and socket joint, and so it has 6 degrees of freedom in terms of motion. So it kind of goes forward, backwards, side to side, and rotates. And then on top of that, you've got all these muscles, and the muscles are really stabilizers of the hip. And so you've got the hip joint itself that can become irritated, and the muscles help stabilize around that joint and offload that joint to an extent. You can also irritate the muscles, and we can talk about that more as well. So that's kind of from the front. We've got several hip flexor muscles, including the sartorius, the iliopsoas is this muscle through here, and then the rec fem is also a hip flexor, as well as the TFL, and that kind of makes up the primary muscles that move your knee up towards your chest as you're going through a running cycle or a gait cycle. And then we've got on the outside of the hip, so same bones, just different angle. You can kind of see the hip joint a little bit better. A lot of people have labral problems, which is not pictured here, but it's this cartilage capsule that kind of surrounds the hip joint, the soft tissue lining that surrounds the hip joint, and that can become irritated and symptomatic. So we spend time addressing that. And then this is kind of from the side angle, this is where you talk about a little bit of the traditional diagnoses of like bursitis, trochanteric bursitis, IT band syndrome. This white sheath is the iliotibial band that can get irritated over the hip. You can strain or sprain a glute muscle, so you can sprain your glute med. This is glute min, a little bit lower down, or excuse me, piriformis, a little bit lower down. And then this is just another angle of TFL that we saw on the front. So this is the hip from the back, and same bones, like we talked about, and not a lot else to show there, but you can see there's some pretty big muscles along the backside. So you got the glute med, which we saw earlier. This big, large muscle is your glute max, and that's really important for power generation, especially with push off, but also absorbing some of the forces in a walking or running gait of the hip. And then lower down, you've got some of the hamstrings that come down the backside of the hip. So before we get into kinesiology, let's just take a look at that from more of like a 3D perspective, where this is actually the other hip as well. So, or excuse me, this is the right hip. And if we take all the muscles away, you're left with the hip joint itself and the bones surrounding the hip. And there's lots of other things that are not pictured here, like the hip joint capsule, as well as if we go a little bit deeper than the capsule, this is where you dive in and you get the labrum. And so that's something that commonly becomes irritated, especially with runners, and groin pain, groin issues. Other mechanisms or other sources of pain at the hip include a lot of the muscles. And so when you're talking about anterior hip pain, which we're going to dive into a little bit deeper, you're talking about muscle like the tensor fasciae lata, the TFL, the sartorius, and the rec fem. Those are all big hip flexors, as well as the iliopsoas. They kind of bring the knee towards the chest, and then rotate that around. Looking at the back side, or kind of side slash back side, you got the glute max, huge muscle that extends the hip. We hide that. You've got the glute med, and then under that is the glute min. And so those are all important muscles in stabilizing the hip joint, as well as preventing any hip drop during the running gait. So we're going to talk about that a little bit in the future. We're not going to dwell so much on pain in the backside. We're going to address that more in the next webinar, which is all on the lumbar spine, because a lot of times these go hand in hand, where you have pain on the backside of your hip that is not necessarily related to the muscles on the backside of the hip, but more referred from the spine, because they're so close in proximity and are very interrelated. You can't really treat one without treating the other. So that's just more of a 3D view of the hip. Now let's get into the kinesiology of the hip and the gait cycle. And so what we're focused on is really this first 40% of the gait cycle. As physical therapists, we look at the stance phase of gait primarily. That's not to say you can't have pain in the swing phase, but in the stance phase is where you're putting the body weight through your muscles and joints and ligaments and soft tissue. And so that's where you're absorbing the most force. And so just from a loading perspective, it makes sense to address loading issues in the stance phase of the gait cycle for runners or anybody walking or having pain with walking or pain with running. That's where we're kind of addressing a lot of these issues. And so the stance phase is this kind of takes up about 40% of the gait cycle. And when we look at that with the hip, we look at the hip flexion angles. So taking a line from the torso and going through the hip and then through the knee, and we want about 30 degrees of flexion off of complete extension. So we're looking at this angle kind of here. And then when we're looking at terminal stance, the hip is a lot straighter, and it's only got about 5 degrees of hip flexion. And so that's kind of what an ideal of what we look for when we do video analysis on the treadmill for runners. And what that looks like conceptually, this is me running on the treadmill, and let's go through this and draw. We're just going to go through this, and I'm going to slow it down and then kind of find where I hit the ground. So I'm finding kind of that initial contact, and then I'm going to draw a line from my torso through my knee, and then we're going to actually take this angle. So we're going to find the straight line, which would be 180. 180 minus 147 is 33. So we're taking this angle right here. So we have about 33 degrees of hip flexion at initial contact, and that's kind of what we want. We were saying like around 30 degrees. And then as you go through the gait cycle, you get more into extension, closer to a straight line. You kind of go from 30 to 30 to 30 to 20 to 10 to around 10 to 5 degrees, sometimes less than that, like I'm at like 5 or 4 degrees here. If we're just looking at hip flexion, or pretty much almost straight, really, right, once we get it all lined up. And so that's kind of what we're looking for in this plane of motion from a movement perspective. So we're talking about pain at the hip. We're just going to go over kind of this generic term called anterior hip pain, and there's a lot of things that kind of land in this bucket. Hip flexor irritation or hip flexor pain or groin pain fall into that. Labral pain often presents on the front of the hip, and anterior just means on the front of the hip. So when we're talking about anterior hip pain, we're talking about hip that is around the front of the hip. Muscles, tendon, ligaments, and the hip capsule get strained or sprained. And so if something gets irritated through the front of the hip, a lot of times the pain will kind of move around. Like it won't be in one specific spot. It's not specific. It can be dull, achy. Initially, it could be sharp or shooting. And sometimes it'll wrap kind of from the front around to the back in this C-shaped pattern, kind of over the ilium around to the back of the hip. And for runners, this occurs with a sudden increase in miles, sudden increase in intensity, overstriding, which we're going to go over, going from a uniplanar sport to a multiplanar sport. So like if you only run and then try to do a lot of cutting, like if you start playing pickup soccer or pickup basketball and try to do a lot of lateral motion, that can irritate it, as well as pivoting. And if you're not a runner, sudden increase in loading, right? And so if you suddenly start a lifting program and you just kind of jump full bore into it, that can cause some of this pain, as well as lifting too heavy too quickly would be other examples of when you would get anterior hip pain. So the treatment of this is really to work the muscles at the backside of the hip. So glute recruitment, that's like working some of these muscles back here, especially glute med, which is highlighted, as well as glute max along the backside of the hip. We're looking at core stability, so really getting the whole spine and lower abdomen involved, and getting good abdominal recruitment through your obliques and your transverse abdominis, and to a lesser extent through your rectus abdominis, your six-pack. And then working on running form, we're going to look at hip drop and overstriding specifically and what that looks like on the treadmill. And then we're going to go, we'll get into some strengthening exercises, primarily the glute, but we might hit some of this other stuff as well at the end of this lecture webinar. And then ancillary, so we're pretty big on loading and strengthening of the hip. I call these other things ancillary treatments because they're more passive interventions, like the therapist is doing something to you, but you're not really doing anything actively, which can be good in getting people out of pain, like doing hip mobilization, soft tissue mobilization, where you're doing massage or kind of trying to move through the joint. Foam rolling stretching, we do dry needling in the clinic. Those can all be helpful in terms of opening up a therapeutic window. But what we're really looking at going after over the course of a long term is load over time. Both in terms of corrective exercises, so getting more advanced with our exercises that put more stress through the hip over the course of weeks to months, as well as loading with your running. So if you're trying to get back to running, you're having hip pain, trying to gradually load over time, not just jumping into a high mileage situation. All right, so treating overstriding. So this is me just running on the treadmill, and I'm kind of going to do the same thing where I'm going to find when I initially hit the ground, and you can see as I hit the ground, it's a heel strike, which is not like necessarily bad. I'm going to find where I hit the ground with my heel, and then we're going to kind of bisect my midline with a line, and you can see that I'm pretty far in front of my midline, and so that's a lot of force that's going up through the knee, up through the hip. You're hitting the ground and exerting 3 to 6 times your body weight through the ground, and that force is in turn coming back and going through the hip. And so that's kind of what we mean when we talk about overstriding, and it's just putting a lot of force in that hip joint that we don't really need, right? And so that's one faulty movement mechanic. If you had logged in and watched our knee lecture, you would also know that that's pretty common with knee injuries, is to have some kind of overstriding gait mechanics. And so we also want to look at hip drop. You can see just before we play this, my pelvis is relatively level, and I've got 2 markers on kind of where bones in my spine are, and they're also relatively level. And then as we play this, we're gonna find, or I'm gonna find in this video where I hit the ground, and we'll slow it down, and you can see right before I hit the ground here that my waistline is relatively neutral, like it's relatively even. One side's not higher than the other. And I'm going to illustrate that by drawing a line across here. And then as I move through and put more weight through that, my right hip drops quite a bit. And you see this in running, you see it in walking. What this is a hallmark sign of is poor glute recruitment. So I'm not using the muscles on my left side to engage and stabilize and pull my pelvis, kind of rotate my pelvis up. So this is a hallmark sign of poor glute recruitment that can lead to hip pain, both along the backside of the hip, but also definitely through the front of the hip. And so we want to correct that, and a lot of the corrective exercises that we're going to go through later kind of aim at addressing that specifically. So again, it's like you're finding where that midline is. Kind of skip ahead a little bit. So finding that I've got a level pelvis here, and then as I put more weight through that leg, my opposite hip drops, and that's representative of weakness on your stance leg sides. As we're really talking about the stance phase of gait, whether we're talking about walking or running, and how do we mitigate forces through the stance phase of gait so that we don't have pain, right? Or that we offload that temporarily and then load it over time so that there's less force, or the force is more controlled through that hip. All right. Any questions so far? So we're going to kind of talk through some of these exercises. I'd encourage you to grab a foam roller if you have one. They're not all going to include a foam roller. We're also going to use like a circular resistance band. So if you have one of those, you can grab that too. But I'm just going to talk through some of these exercises, and we're going to kind of go from passive interventions that are kind of feel good and good at helping with the symptoms, but not necessarily great for long-term resiliency in terms of tissue resiliency. Like, they feel good in the moment, they help downregulate your symptoms, and they provide a therapeutic window for you to be able to do more, whether that's load more with other more resisted exercises, or load more in your daily life, or load more with running, right? And so these are good starter exercises, but they're not curative necessarily, right? And so you just want to be cognizant of that, because a lot of people like the feel good stuff because it gets the pain away or it calms down their symptoms, but it's not really curative in the long-term sense. What's better for over the long term is developing strength over time, and developing resiliency in your soft tissues and your muscles and your bones over the course of weeks to months, right? So that's really what we try to emphasize. But to start out, some mobility exercises, Sammy's kind of talking you through. I'm just going to do it verbally here. But she's kind of found, she got the foam roller, she's rolling through her quad, through the muscle of the front of the hip, putting the full weight of her body on her right hip when she lifts her left leg up. And she's kind of going back and forth, finding that kind of the hurt so good spot. If you've used a foam roller before, you kind of know that feeling. And you tack down on that spot and then floss your leg back and forth. And you can do this with a foam roller. If you want to get more specific to the hip, you take a lacrosse ball and get closer to the hip joint itself. And you can do kind of the same thing. Where you're trying, and you can also do different portions of the hip, which is what Sammy's describing now. Like, you can do outside of the hip, the inside of the hip, or kind of down the center of the thigh, right? And so those are all good options. Another good one that is harder to do with the lacrosse ball, so really probably should be done with the foam roller, is that like if you're having groin pain, working through the muscles of the inner thigh are going to be important. So she's kind of got the foam roller perpendicular to her thigh, and she's starting down by her knee, but you can really start at your knee, find a spot that's a little bit tender and irritated, and then bend your knee back and forth. But really, you can take this foam roller and work all the way up until you're kind of like in the groin area. And that's where the muscle belly is, like the flesh of the muscle, and where you generate a lot of the power of the muscle. And so, another good kind of feel good exercise to help mobilize through the hip with the foam roller. And she's got a foam roller that's like kind of plastic and knobby. Knobby foam rollers are more aggressive, so you could start with just an actual foam roller, where it's just like a piece of foam, and then work up from there. Like I said, with the quad foam roller, with the quad foam roll, you can really do that with a lacrosse ball as well, which is that way you can dig into the hip a little bit more and get a little bit more bang for your buck because it's less surface area, so it's just a little bit more pointed. All right. So this one, she is doing the mobilization with a lacrosse ball. You can definitely use a foam roller for this one too, but what she's doing is she's just going to try to sit on the lacrosse ball. You can do it sitting down on the floor, which is a little bit more aggressive because you're putting the full weight of your body through the hip as you mobilize the muscles of your glute, so glute med, glute max. Sitting down is just going to be more aggressive, but we're really looking to get mobilization through the front, or excuse me, through the back of the hip, as well as kind of on the side. So she's kind of sitting at an angle, and just kind of digging into that. If that's if you do that with a lacrosse ball, that's pretty aggressive. You could also do it with a foam roller on the wall. And if you've been in, or if you've had any of our other bottom-up lectures or webinars, then you'll know that the knee overlaps significantly with some of this stuff because, again, they're very related in terms of treating the knee and the hips. So these are all ones that we did go over with the knee initially. That's one of the dogs. So we're just going to pause, let him bark. But yeah, one of the exercises that we did go over in the knee as well. Now, in terms of stretching, there's a couple stretches that we would use in the clinic. Primarily, the couch stretch is a good one for the front of the hip. You don't want to be super aggressive with this because if you do anything too much, it can kind of irritate it. But what we're trying to do here is get a little bit of abdominal engagement where the pelvis is in more of a neutral spine. And so she's trying to engage through her core and not let her spine just arch as she goes into this stretch. So she's got good core engagement, and then she's taking her hip and kind of leaning forward while maintaining some amount of core engagement. And to make this harder, you would prop your leg up on a couch. That's why it's called the couch stretch. You don't necessarily need it on a couch. Like, you could start just in kind of a split squat position, a kneeling split squat position, or a half kneeling position, engaging through your core and then leaning forward and leaning into it. And you'll feel a little bit of that stretch through the front of your hip. So for her, she's stretching out through her left hip, engaging through her core, leaning forward, and getting a little bit of stretch through the front of her hip. All right. Any questions so far? I'll let you give those a try. I'm just going to quickly check the chat. All right, so a couple more mobility type exercises. Again, these are good exercises to get you moving. You're not developing, you might be helping your range of motion, but you're really not developing strength, which is what we're looking for long-term gains. The 90-90 hip switch is a good exercise to get that range of motion and to work on mobility. And so for this one, you're going to be in a 90 position at the knee, at both knees, as well as kind of through the pelvis. You're in a 90-degree angle. And what she's doing here is just sitting into that and allowing both of her hips to stretch. So you're stretching external rotation on the right hip and internal rotation on the left hip. And then what she's doing is just a pull where she's bringing her foot up and then pushing it down into the ground. And so that's a contract relax technique where she's pulling her leg up and then pushing it into the ground. And you can see she's got a lot more range of motion if she uses her hand. And so part of the goal with this exercise is to develop more strength over time. You're not going to get all the way up through actively pulling your foot up, but the goal is to develop a little bit more strength so that you can actually pull your foot up a little bit and then maybe a little bit more over time. So she's kind of pushing it into the ground for 5 seconds and holding that, and then pulling her foot up and holding that for about 5 seconds as well. So sorry, this is mislabeled. This is actually the 90-90 contract relax, but they're conceptually very similar. We'll go over the 90-90 hip switch right now. So the 90-90 hip switch is more of a stretch where you're kind of getting in that same position and then going back and forth, doing a little bit of an extended hold. So same position where she's 90-degree angles through her knees, 90-degree angles through her hips, and she's just letting her hips open up and stretching into that. And if you want to get a little bit more stretch, you would lean forward. And then she's changing directions, and that's going to change where you feel the stretch quite a bit. So she's just kind of leaning into that, holding for a second or two, and then alternating back around and just going back and forth. And you can kind of pick your poison if you want to do 5-second holds or 10-second holds. For some people, if you are a little bit irritated, this is a little bit of an aggressive position. So you just want to keep that in mind. We don't want you doing exercises that really force any pain. Maybe a little bit of tension is okay, but we don't want to be like pushing into a ton of pain, whether we're doing mobility or strength type exercises. All right. So this is a classic figure 4 stretch, really hitting the glutes along the back side of the hip. What Sammy's doing is just laying down. She's going to take one leg, put it on top of her other knee. So this is stretching her right hip. You're going to feel it along the right side. And then to make that more aggressive, she's going to sit up. So she's in more of a hip flexion. So she's now way more bent through her hip and pushing her hip away. Another way to get a little bit more of a stretch would be to put your opposite leg, would be to put your left leg on the wall and kind of lean back or just lay on your back and then push your hip away. So all of those techniques, whether you're doing it laying down, which is the least aggressive way of doing that, just laying down and letting your hip stretch, maybe bringing your knee a little bit closer, your heel a little bit closer to your butt. And then you can push away if you want, or you can get in more of an aggressive hip angle where she's really folded through her hip now, and now she's even pushing it more by pushing her hip away. So those are all good techniques to get a little bit of a stretch through the glute, and you will feel it through the front. We don't want it to be painful through the front, so just keep that in mind. You're not trying to get any pinchy sensation or pain through the front of the hip necessarily. And again, we have dog noise So I'm just gonna sit and let Penny drink because she typically drinks for quite a while. So let's just pause, grab a drink of water if you need it, um, but we'll resume shortly. All right. So this next one is a hip-controlled articular rotation, or a hip car. So Sammy's going to get on her hands and knees, and then the goal is really just to move through most ranges of the hip. And so she's first stabilizing through her core. So she's kind of engaging her abdominals, trying to prevent any back extension. She's moderately successful at that. And then she's first extending her hip and then bringing it out to her side and then back down to kind of where she started and just going back and forth like that. And we're trying to get all that motion through the hip and not necessarily through the lower back. And that's why she's trying to engage through the core. So we're trying to get good engagement through the hip joint in all ranges. And you can see she's going in both directions. So you can go like clockwise as well as counterclockwise to kind of engage muscles, different muscles, or engage muscles uniquely, the same muscles uniquely. All right, so those exercises were all kind of mobility exercises where you weren't doing a lot to work on strengthening your hip. There is more just to work on range of motion, as well as the foam rolling kind of helps loosen up the muscles, and they're all kind of feel good type exercises. This is where we're starting to get muscle engagement of the hip with the knee, and we're kind of keeping them in because they're really hip exercises, but we're using them to treat knee pain. But now we're really trying to use them to address knee exercises, or excuse me, the hip strength and control. So the first one, Sammy's just got the band around her knees. She's in a mini squat position, band around her knees in a little bit of an athletic stance. And then she's taking her right knee, dropping it in, and then pulling it out. And she's pulling it out using primarily the glutes along the backside and the side of her hip, and trying to get that more even. She doesn't need to force it out. She's just trying to get it more even or in line with her hip, and then going back and forth like that. So a lot of times with hip drop, the knee will also come in. And so if we're looking at gait analysis, whether it's running or walking, and we see like the knee diving in, or you're doing a single leg squat and you see the knee diving in, this would be a good exercise to address that. Just make sure that you're not just thinking about what your knee's doing, but also engaging through your glutes along the backside. This next exercise, you'll kind of feel it along the side of your hip, the back of your hip, where she's got the band around her ankles and she's reaching out to the side as well as a little bit backwards. So she's probably angled backwards 30 to 40 degrees and reaching with her right leg. And what she's pointing out now is that you want to be cognizant and thinking about what your stance leg is doing and not letting your stance leg knee dive in. And when we look at the running gait cycle or the walking gait cycle, we're really focused on what is the stance leg doing, and not letting the stance leg dive in or collapse through the knee or the hip. We want to stay strong and keep the knee out. All right, so now she's demonstrating tempo squats. So she's got the band around her knees, and she's going to go down on a 5-second count, hold it at the bottom for 3 seconds, and then come back up. And so we're really working on eccentric control, where the downward motion, you're doing that slow. So you're kind of, as you squat down, a lot of the hip muscles, particularly the glutes along the backside of the hip, are lengthening as you're getting more into hip flexion. So you're working those muscles in a lengthened position. The band helps engage the glutes a little bit more, and then coming back up. So 5-second count going down, nice and slow. She could probably be going a tad slower, holding at the bottom for 3 seconds, and then coming back up at like a normal speed. All right, this last one is a lateral lunge to a high knee. Very functional. With running, we don't necessarily want to just work on addressing strength in the front and in the back, even though we kind of run in a straight line. Most of the times, we also want to work muscles along the side. And so this is a good one for that, working on lateral motion. And she's going into a lunge, and then she's trying to balance for a second or two at the top. And remember, thinking about the stance leg for the running gait cycle or the walking gait cycle, thinking about what that stance leg is doing and trying to control the knee, try not to let it snap in or do anything wonky as she's trying to balance on that stance leg. And then she's marching up, which is also a very functional motion. So she's marching up on her right leg and using the hip flexors along the front of her right leg for that motion. So a little bit more advanced, and that's kind of the theme of this. We started like simple muscle engagements type exercises, and then we are getting a little bit more advanced as we go through this lecture or webinar. All right, speaking of advanced, we're going to go over bridges. And bridges, you can do a double leg bridge that is relatively straightforward, or this is demonstrating a little bit harder single leg bridge where you've got the band around your knees, lifting your butt up, and then kicking out on your other leg. And you'll really feel this on your stance leg hip, which is kind of what we want. So I would be feeling this standing on my right leg, kicking on my left. You will feel it on the left side, but more so thinking about gait mechanics, wanting to be working on developing strength on the stance leg. And so this is a good exercise for both of those. It's a little bit more advanced again. So I would suggest starting just doing a normal bridge with a band around your knees to get good glute engagement, and then working into something a little bit more dynamic like this. This next exercise, I've got the band around my knees, and I'm in kind of like a fire hydrant position. So if you were to be on the floor on your hands and knees, I'm kind of taking that same position where I'm bent through my knee, bent through my hip. I've got my arms out to stabilize, and then I'm just holding pressure. And I've kind of kicked my right leg out and a little bit back. So I'm just holding that position, and you can hold for up to 30 seconds. And if you hold for up to 30 seconds, you should feel both engagement in your stance leg as well as your kicking leg. And now I'm kind of demonstrating what that would look like actively. So a lot of times in the clinic, we'll do an isometric hold where we're just holding this position, followed by 5 to 10 reps where you're moving through that motion. And moving through that motion is a lot harder because you're thinking about, one, trying to maintain balance, but also two, trying not to let your stance leg knee dive in, right? And trying to get a nice stable base of support through your hips. If you think about hip drop, this is a really great exercise to address hip drop with running and walking gait, because you are just getting a lot of good glute engagement through your left side with this exercise. All right, final two exercises. So when we talk about anterior hip pain, like pain along the front of the hip, we a lot of times do work on strengthening the glutes along the back side of the hip, as well as the muscles on the side of the hip, but we shouldn't neglect the muscles in the front of the hip, which are commonly the muscles that are most irritated. So this is just a good way to address that off the bat. And this is these two, banded hip flexion level 1, banded hip flexion level 2, is just like a stepwise progression. So starting with this one, laying on your back, Sammy's trying to get really good abdominal engagement, where she's kind of drawing her belly button towards your spine so that she's stabilizing her pelvis, and then moving through her hip by bending her knee up, and she's got a band around her feet. And so stabilizing through her spine, and then marching her hip up, and then doing the opposite. And just coming back and forth like that is a really good intro level exercise for the muscles in the front of the hip. If it's too much, or if it's painful through the front of the hip, then I would take away the band and just do this without a band to start. And then this is kind of the progression to that. So, maybe in a month or two, this would be more appropriate, especially if you're in pain with a band first with this one. I'd wait on this one, but this is like what you would do later on as a progression from band and hip flexion level 1, you do band and hip flexion level 2, where you're engaging through your core, stabilizing your spine, but you're starting in a tabletop position, holding a tabletop position, and then switching legs, keeping in mind what your spine's doing. And you should feel a good burn through the front of your hip with doing that. All right, so that is the extent of the exercises. I went through those kind of quick, but also don't want to take up too much of your time because we are going to send this out as a recording, so you can always go back and reference these exercises. In the future, we do have one more bottom-up series, bottom-up strength series on the spine. If you missed any of the other bottom-up strength series lectures, you can go to our website, and if you just go to our main page and then click on courses, you'll be able to access the foot, the ankle, the knee, as well as the hip. And I should get the hip up in the next day or two. We've also got another webinar going on that's centered around overtraining for the endurance athlete. And we've got one more lecture in that series in about 2 weeks' time, and that is on tendinopathies. And so talking about overtraining and how that affects tendon health. And previous webinars, we had talked about bone health, youth athletes, youth endurance athletes, as well as nutrition and a general overview of overtraining. So go ahead and check those out. They're all at our website. For future events, for future live events, go to our website and click the events tab. If you're watching this and you want to get in for a PT session, we're happy to give 50% off your initial session through the end of the month. Does anybody have any questions for me now?